Hello everyone, this is Raina and I'm going to be presenting on lesbian, gay, bisexual, and transgender health disparities and health promotion, along with the role that occupational therapists have with this population. So the learning objectives for this presentation are as follows: limitations in research, health disparities, physical environment, social determinants, OT's role, and OT practice guidelines. The main goal of Healthy People 2030 is to improve the health, safety, and well-being of LGBT people. Lesbian, gay, bisexual, and transgender people experience many specific health-related challenges and disparities. Healthy People 2030 focuses on collecting data on LGBT health issues and improving the health of LGBT adolescents in particular. Adolescents are especially at risk for being bullied, thinking about and dying from suicide, and using illegal drugs. School and family-based interventions can help reduce these behaviors and improve health in LGBT adolescents. Why is LGBT health important? Eliminating health disparities and enhancing efforts to improve health are necessary to ensure that LGBT individuals can lead long, healthy lives. The many benefits of addressing health concerns and reducing disparities are reductions in disease transmission and progression, increased mental and physical well-being, reduced healthcare costs, and increased longevity. Limitations in research. There is a need for more research to document, understand, and address the environmental factors that contribute to health disparities in the LGBT community. In order to accomplish this, we need to increase the number of nationally representative health-related surveys that collect information on sexual orientation and gender identity. Collecting population-level data is key to meeting the needs of LGBT people, but not all state and national surveys include questions about sexual orientation and gender identity. Adding these types of questions to surveys can help inform effective health promotion strategies for LGBT people. Clinical and public health studies on LGBT health are rare. Historically, they are small, convenient samples, more recently, larger population-based studies, and lack of funding is a major challenge. Some study designs overestimate pathology. For example, studies on alcohol use that they recruited from bars. Inclusion of sexual orientation measures in government surveys is very recent, non-routine, and limited in scope. Transgender and bisexual specific research is still extremely limited. Research suggests that LGBT individuals face health disparities linked to societal stigma, discrimination, and denial of their civil and human rights. Discrimination against LGBT persons has been associated with high rates of psychiatric disorders, substance abuse, and suicide. Experiences of violence and victimization are frequent and have long-lasting effects on the individual and the community. Personal, family, and social acceptance of sexual orientation and gender identity affect the mental health and personal safety of LGBT individuals. Social determinants affecting the health of LGBT individuals largely relate to oppression and discrimination. Examples include legal discrimination in access to health insurance, employment, housing, marriage, adoption, and retirement benefits, lack of laws protecting against bullying in schools, lack of social programs targeted to or appropriate for LGBT youth, adults, and elders, and shortage of healthcare providers who are knowledgeable and culturally competent in LGBT health. The physical environment that contributes to healthy LGBT individuals includes safe schools, neighborhoods, and housing, access to recreational facilities and activities, availability of safe meeting places, and access to health services. Now we'll talk about occupational therapy's role with LGBT clients. The person-environment occupation, or PEO model, is seen here to examine the relationship between sexual orientation, gender identity, and occupation, and for exploring the potential roles of OTs in providing a service to LGBT clients. Occupational performance results from the dynamic relationship between people, the environment in which they live, work, and play, and the occupations they engage in. Some examples of LGBT-specific issues that are relevant to OT practice are listed under the headings of person, environment, and occupation. When considering person-related factors, a therapist should consider how the client views themselves, how comfortable they are with their sexual orientation and gender identity. Literature indicates that LGBT individuals are more likely to have issues with self-esteem and self-acceptance. Therapists should be aware of the personal challenges that LGBT clients may have had due to their experience of belonging to a social minority. These individuals are more likely than their heterosexual peers to experience a mental health condition such as depression or anxiety. Therapists should consider the unique life events and circumstances that relate to an LGBT person, such as their experiences of coming out to family and others, how they relate to the media's portrayal of LGBT people, and spiritual challenges they may face if they are attempting to reconcile their true identity with contradictory religious beliefs. These events can shape a client's personal expectations either positively or negatively. Therapists working with LGBT clients should consider the various environments that their clients experience and how their identity affects their interactions. For an LGBT person, particular experiences of their physical, social, and cultural environment can have a negative effect on their occupational identity, occupational performance, and well-being. Participating in occupations can positively impact physical and mental health and enhance quality of life. A person's sexual orientation and gender identity can have a significant influence on their occupations and roles, as well as their life decisions and goals. The occupations that a person chooses to engage in are often a reflection of their values, commitments, and interests, as well as the social context of their particular family, communities, and country. Consider the impact that a client's LGBT identity can have on all of their occupations, whether they are related to self-care, productivity, or leisure. When a client's LGBT identity may have no significant impact on their occupations, sometimes it can create barriers to occupational engagement. A client-centered approach with these clients will primarily focus on the person's occupational performance while recognizing and responding to any LGBT-related needs. Here are some guidelines to inform occupational therapists how to provide LGBT-friendly and inclusive services. Sexual orientation and gender identity are core parts of everyone's identity and are relevant to a person-centered practice of every occupational therapist. First, be aware that 1 in 10 people identify as LGBT. While LGBT people may be using occupational services for reasons unrelated to their identity, an inclusive approach is still required for good practice. 2. Consult the evidence. It is important to have an evidence-based approach to practice. Keep up to date with emerging evidence in relation to LGBT people. 3. Use occupational therapy theory and skills. Draw on your existing knowledge of OT theory to practice an LGBT inclusive way. Use your core OT skills that you already have rather than thinking if you need new skills. Take a client-centered approach. Good practice means taking a proactive LGBT-friendly approach. Having an awareness of these differences means we can ensure client-centered approach is taken. Be guided by the client. Ensure you provide a safe space, respect confidentiality, and take a professional approach. Be aware that although a client is out to you, they may not be out to other people. Use correct terminology. The correct terms to use when referring to LGBT clients are lesbian, gay, bisexual, or transgender, or their preferred term for their sexual orientation or identity. If you are unsure, ask your client in a sensitive way. And lastly, respect preferred name and pronoun. If you have a transgender client, use the name and pronouns they would like you to use verbally, in writing, and on their file. If you misname or misgender a client, simply acknowledge your mistake and apologize. Clients who identify as non-binary may prefer the use of the pronouns they and their. In conclusion, I hope these guidelines empower you to reflect on inclusivity in your own personal and professional life. It is important that all therapists have good knowledge and understanding of the range of issues facing LGBT people. Given the client-centered and holistic nature of this profession, OTs have huge potential to advocate for and become champions of LGBT inclusive practice. I hope I have inspired you to do so. Thank you.